Hi, everybody. This is Lee, and I'm talking about the American Health Care Act and the CBO score, which is just a big old horror show. How else can you describe it? It's just an example of the inability, it seems, of the House Republicans to govern or even make good decisions. That their frame of reference is so odd and obscene that it makes you wonder, like, of course, what are they thinking? And then what are they doing? And then, okay, what are we paying them, in the form of our taxes to think and to do? Are we actually getting our money's worth out of our Republican Congress? And I'm thinking, based on the legislation that we're seeing, no. Okay. So I'm looking at an article at MedPage today, which is discussing the CBO score, the Congressional Budget Office, which analyzed the healthcare package that was reassembled by the Republicans in the House, and apparently it was supposed to be better. And we see that not really. The score is just very disheartening. But let's go through it. It's DC weak, CBO still see surge, and uninsured with AHCA. And so, the numbers are in, they're not pretty, and that the American Health Care Act is going to actually show that there will be more uninsured, losing to deficit reduction, and that an estimated 14 million more people under 65 would be uninsured in 2018 compared with the current law that we have, the American Health Care Act, or the Affordable Health Care Act, the Obamacare. And that by 2026, the increase over status quo would rise to 23 million uninsured. And so that was a revision up from 24 million previously, which is still not good. And so it would also decrease the deficit by 119 billion from 2017 to 2026. And that means that this bill would remain filibuster proof in the Senate if it were brought to a vote there. And so our eyes have to turn to the Senate and what they're thinking and what they're planning, what they're going to do with their bill. And so these are the modest changes that we've seen, and that for moderates concerned about the hit on the uninsured, they should be equally concerned. For conservatives who wanted more deficit reduction or lowering of premiums, it's pretty moderate difference, and so it's really not that great, is what people are saying. But basically, the bill itself, the AHCA, is a punch to the gut, as this article describes it, to health science research priorities, and that's according to physician groups and independent scholars. And that there's also commentary from other health agencies as well. And so there's also an MD who's president of the American Academy of Family Physicians. He says that slashing funds for the critical federal agencies that oversee the healthcare industry, which is 17% of the U.S. economy, it destabilizes the foundations of services on which patients depend, and undermine health security for nearly 60 million elderly through Medicare and nearly 75 million adults and children through Medicaid. And so there are lots of concerns in all directions about the, Trump tax plan. And then, of course, this new health care package or health insurance package that's been put together. Doesn't look good. I am still hopeful that HR 676, John Conyers' bill, will be brought to the floor for consideration. by Nancy Pelosi, who's actually standing in the way, blocking it for years. But hopefully we can get around her somehow. I don't know. It might be with the 2018 Congress, but it would be interesting to see what the CBO score for the expanded and improved health or expanded and improved Medicare Act, John Conyers bill, what that would be. It's been a long time coming. Would love to see a score. Would love to see Bernie Sanders come out with his Senate version that we've been hearing about, hopefully sooner than later. I think the time is coming, or maybe it has been time already. I don't know how these political insider things get done, when to bring things to the floor, but we need something good to focus on, something to think about, to believe in, and a health care package for all is that. We'd like to see it soon. Good luck.